Today I'm doing Scarlet for the back. And the reason why I'm doing that is because our patient has had acne as a teenager and she has some acne scars back here. So we're treating that with our radiofrequency microneedling love, which is Scarlet. So Scarlet, the way it works is that there's 25 little baby needles that come down and they slide into the skin, and when they get to the depth that I have programmed in, they're going to release radiofrequency. So the needles poke at the fibroblasts that make collagen, and they're going to help her make collagen. The radiofrequency part of it is going to irritate the fibroblasts that make collagen, and she's going to make collagen. So two different ways to make collagen. Then as the needles come up, the radiofrequency follows. So every single layer of her skin is getting exposure to radiofrequency, which is an energy that tightens. And then she's left with a little tiny channel, and that channel is going to have to tighten as well. So she's having two different ways to make collagen and two different ways to tighten. So it's really great for lifting and tightening, obviously for collagen production, but for scars it's wonderful, and for texture it's great for pores. If you're doing it on your face, it's great for rosacea. So it's really good for redness because the radiofrequency is heat and it's going to help shut down that vascularity. So lots of good reasons to do Scarlet. And Scarlet is really powerful. It's 2 times the power of other radiofrequency devices. So that is one of the many reasons why we bought Scarlet as opposed to some of the other microneedling radiofrequency devices, because of the double the power. And then the Na effect, which I just talked about, which is where the radiofrequency actually follows the needles back up as it goes through your skin. So you can't say that about most other radiofrequency microneedling devices. But you could see that she's got some histamine reaction here going on her back, which is exactly what you want to see. But really there's not going to be any downtime for her. I would tell her though not to go into a lake or jump in a mud bath because there are thousands of open channels, probably not even a hot tub for the first week, just to let all of those channels heal up, and then she can do what she wants. When we do treatments on the body, I always recommend 1 treatment a month for 6 months, and then 4 treatments a year. Usually the body requires more treatments than the face, but at least 6 treatments, especially if you're treating something like scarring. The one thing Scarlet won't treat is hyperpigmentation, so it's not going to be great for brown spots, but good for redness, like I said, pores on the face, texture, of course, lifting, tightening, helping with scars, all the things I already talked about, with little to no downtime. Every skin type could use Scarlet too. It doesn't matter if you're really, really dark or really, really light, but everybody could do Scarlet. And it looks like, our patient isn't even using Pronox. I like to use Pronox when I get my Scarlet done because I'm a baby, but our patient's super tough. But Pronox is laughing gas, so you could make it even more comfortable by having laughing gas, but some people don't even need that.